mentioned high risk myeloma earlier. How do you determine if a patient is high risk or low risk?
Absolutely. So this is not uniformly agreed upon among myeloma doctors, but in general, we assess risk based on a few different things. One is called staging, and we stage myeloma unlike any other cancer. So it's not staged like breast cancer or lung cancer or prostate cancer. It's staged according to something called R-ISS. And you get basically a 1, 2, or a 3. Those are your stages. And in general, if you're stage 3, you have higher risk disease. But even more than that, we're beginning to understand how myeloma cells misbehave at the genetic level. And we know that there are certain genetic findings inside the myeloma cell that can convey higher risk features. And it's important to stress to patients that these are not genetic findings that they were born with or can pass on through hereditary. These are findings that occurred during the life of the patient, that occurred by chance and developed inside that cell that turned into myeloma. And those are the genetic changes that we're talking about. And we know that certain of these genetic changes confer higher risk disease. And in general, Catherine, if I see 100 people with myeloma, about 85 of the 100 will fall into what I call a standard risk category, and about 15% will fall into what we call the high risk category.